The heart is a muscular organ located in the middle mediastinum and is enclosed by a sac called a pericardium. It is roughly the size of the fist and weighs approximately 300 to 500 grams. The heart has four surfaces. Inferior surface, also known as the diaphragmatic surface. Anterior surface or sternocostal surface. Right pulmonary surface and the left pulmonary surface. The right heart consists of two chambers, right atrium and right ventricle. The left heart also consists of two chambers, left atrium and the left ventricle. This makes up four chambers of the heart. The coronary sulcus circles the heart, separating atria from the ventricles. The anterior interventricular sulcus separates the right and left ventricles anteriorly, and posterior interventricular sulcus separates the right and left ventricles posteriorly. There are four valves in the heart which ensures unidirectional blood flow, preventing regurgitation. The mitral valve, also known as the bicuspid valve, is in between left atrium and the left ventricle. The tricuspid valve is in between the right atrium and right ventricle. The aortic valve is present in between the left ventricle and aorta, and the pulmonary valve is present in between the right ventricle and the pulmonary trunk. Mitral valve and tricuspid valve together are known as the atrioventricular valves. Pulmonary and aortic valves together are known as the semilunar valves. Now let's talk about the borders of the heart. The upper border passes through the third costal cartilage. The lower border of the heart passes through the fifth intercostal space. The right border is on 1 centimeter right of the sternum, and the left border is at the mid-clavicular line. Therefore, the apex of the heart is at 5th intercostal space, mid-clavicular line. Cardiac skeleton is a dense framework of fibrous connective tissue that gives structural support to the heart, acts as a muscle attachment site, provides electrical insulation, and maintains the three-dimensional geometry of the heart. Cardiac skeleton consists of right fibrous trigone, left fibrous trigone, fibrous ring around the mitral valve, fibrous ring around the tricuspid valve, fibrous ring around the aortic valve, and around the pulmonary valve. Now let's take a closer look at each valve. The mitral valve has two leaflets, the anterior leaflet and the posterior leaflet. The tricuspid valve has three leaflets, the anterior, septal and posterior leaflet. In the case of aortic and pulmonary valve, the term cusp is used instead of the term leaflets because they are smaller pocket-shaped flaps that look like a cup, and the space inside the cup is called the sinus. The aortic valve has right, left and posterior cusp. The pulmonary valve also has right and left but with anterior cusp. When you look at the heart internally, you may see something called the subvalvular apparatus. This subvalvular apparatus includes two main components, the chorda tendineae, papillary muscles. The papillary muscles are conical muscular projections that arise from the ventricular walls and connect to the valve leaflets through a fibrous cord called the chorda tendineae. There are two papillary muscles on the left which connects to the mitral valve with two leaflets. And there are three papillary muscles on the right which connects to the tricuspid valve with three leaflets. There are two important remnants of fetal circulation: ligamentum arteriosus and fossa ovalis. Both of these structures are like footprints left behind from fetal life. The ligamentum arteriosus is a fibrous remnant of fetal ductus arteriosus, which in fetal life connected the pulmonary trunk to the descending aorta. The fossa ovalis is an oval depression on interarterial septum of adult heart, representing the remnant of fetal foramen ovale, which allowed blood to pass from the right atrium to the left atrium before birth. The conduction system of the heart is like a built-in wiring. The sinoatrial node, also known as the pacemaker of the heart, is located in the right atrium adjacent to the opening of superior vena cava. It spontaneously generates action potential, which is converted to electrical impulses. These impulses are then spread through the atrial muscle fibers. The arterioventricular node, which is present within the interarterial septum, receives the impulse from the SA node and passes to the bundle of His. The bundle of His then splits into right and left bundle branch. The impulses travels through the bundle branch, finally reaching the terminating conducting fibers in subendocardium called the Purkinje fibers. The impulses then spreads through the ventricles. The cardiac innervation is governed by autonomic nervous system, which consists of two main divisions: the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is responsible for increased heart rate, increased contractility, increased conduction velocity, and coronary artery dilation. The parasympathetic nervous system is responsible for decreased heart rate, decreased contractility, and decreased conduction velocity. All these fibers converge into cardiac plexus before reaching the heart. The coronary arteries supply oxygenated blood to the heart muscle. There are two major arteries. Left coronary artery arises from the left aortic sinus. Right coronary artery arises from the right aortic sinus. Left coronary artery, after 2 cm on its way, bifurcates into left anterior descending artery, also called the anterior interventricular artery, and left circumflex artery. Left anterior descending artery supplies the anterior wall of the left ventricle, anterior 2/3 of interventricular septum, small part of right ventricle, and cardiac apex. The left circumflex artery supplies the lateral wall of the left ventricle, left atrium, and SA node in 40% of people. The right coronary artery on its way gives off several branches supplying right atrium and right ventricle, inferior wall of the left ventricle, posterior 1/3 of interventricular septum, SA node in 60% of people and AV node in 80% of people. The coronary dominance is determined by which artery gives rise to posterior descending artery. In 60 to 80% of population, right coronary artery gives off posterior descending artery. Therefore, it shows right heart dominance. In only 5 to 10% of population, the left circumflex artery gives off posterior descending artery, showing left heart dominance. Cardiac veins drain deoxygenated blood from the heart muscle. The coronary sinus, present in inferior aspect of left atrium, drains majority of deoxygenated blood into the right atrium. It gets its main tributaries from great cardiac vein, posterior vein of the left ventricle, also called the inferior vein of the left ventricle, middle cardiac vein, also called the inferior interventricular vein, and small cardiac vein. These veins are tiny veins within the wall of the heart that directly drains blood from myocardium into the chambers of the heart, mostly into right atrium and right ventricle, and to a lesser extent into left atrium and left ventricle.